Hello, and welcome to Newborn Bottle Feeding. This presentation was created by Cornerstone Pediatrics. The information on the site is available to you solely for general information purposes. Information on the site is not intended to diagnose or treat any illness. You should talk to your healthcare provider about how information on the site applies to your health conditions. We'll review the following questions. What is bottle feeding? What do I need to know before bottle feeding my infant? How do I bottle feed my infant? What do I do after bottle feeding my infant? And what do I do if my baby won't take the bottle? What is bottle feeding? Bottle feeding is a way to feed infants formula or pumped breast milk. It is a way to nurture your baby and to connect with your baby. What do I need to know before bottle feeding my infant? First, wash your hands. Next, choose the right nipple for your baby's development. Then warm the bottle in a cup of warm water. Microwaving can create boiling hot pockets in liquids and is not recommended for warming baby bottles. How do I bottle feed my infant? First, sit in a comfortable position with your baby semi-upright, with their ears in line with their shoulders and their head tilted slightly upward. Make sure your baby can look at you if they want to. Offer the bottle nipple to your baby with milk filling the nipple by touching the nipple to the baby's mouth and lips. Pause feeding 2 to 3 times to rub the baby's back and encourage burping. Keep milk in the nipple while feeding. What do I do after bottle feeding my infant? Burp your baby by sitting baby upright and rubbing or gently patting their back. Keep your hand from pressing on the baby's neck structures. Keep baby upright another 15 to 30 minutes if typically spits up. Discard leftover formula or breast milk after an hour, and wash bottle parts according to package instructions and let air dry. What do I do if my baby won't take the bottle? Start the feeding when your baby is calm and slightly hungry. You can have another caregiver offer the bottle with the primary caregivers out of the room or perhaps out of the house. Squeeze a drop of milk onto the nipple before starting, and squeeze a drop of milk into baby's mouth after touching nipple to their lips. Thank you for learning with Cornerstone Medical Group. For medical questions, please call your provider. If you are experiencing a medical emergency, please dial 911 immediately. Do not rely on this information as a substitute for professional medical advice. Thank you for learning with Cornerstone Medical Group.